Hello, this is Cassie Story, Director of Nutrition for Bariatric Advantage, and I'm delighted to introduce our presenter today, Dr. Paul Davidson. Today, he will host a webinar titled Strengthen Your Practice by Running Bariatric Support Groups, and don't forget to return for part 2 of the webinar as well. Dr. Davidson serves as the Director of Behavioral Services for the Center of Metabolic and Bariatric Surgery at Brigham and Women's Hospital in Boston, and is an instructor at Harvard Medical School. He earned his PhD in clinical psychology at Brigham Young University. He is a member of the American Society of Metabolic and Bariatric Surgery and was elected to the Integrated Health Executive Council this past year. Dr. Davidson speaks internationally about bariatric topics and heads the behavioral section of the annual Bariatric Summit. He is Associate Editor for the Obesity Surgery Journal and a reviewer for Surgery for Obesity and Related Disorders, Clinical Obesity, and the International Journal of Obesity. He has become very involved with Twitter, if you haven't noticed, and he helps to head the hashtag OBSM chats, focusing on topics related to bariatrics, obesity, diabetes, psychology, exercise, and motivation, and can be found at Paul Davidson, PhD. Before we begin, we wanted to cover a few housekeeping items. At the bottom of your screen are multiple application widgets. They look like little icons. All the widgets are resizable and movable, so feel free to move them around to get the most out of your desktop space. We will be addressing questions at the end of the webinar, so please submit them through the Q&A box during the course of the presentation. We will try to answer these questions at the end, but some may be answered later via email. A copy of today's slide deck is available in the resource list. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in the background that could cause issues. Webinars are bandwidth intensive, so closing any unnecessary browser tabs will help you conserve your bandwidth. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your computer speakers or headset are turned on and the volume is up so you can hear the presenter. Some networks cause slides to advance more slowly than others, so logging off your VPN is recommended. If your slides are behind, pushing F5 on your keyboard will refresh the page. You can find additional answers to some common technical issues located in the Help widget at the bottom of your screen. An on-demand version of the webcast will be available approximately 1 day after the webcast and can be accessed using the same audience link that was sent to you earlier. Without further ado, I would like to hand the microphone over to Dr. Paul Davidson, an esteemed colleague and somebody that I am happy to call a dear friend.
Cassie, I just want to thank you for that very kind introduction. I want to welcome all of you to the webinar today. As you've heard, I'm very actively involved with bariatric support groups. I'm a big believer in them. And I'm hoping by the end of today, during this webinar, you're going to be bigger believers too and understand why it's so valuable to bring them to your practice. And the next following up webinar will teach you more about how to actually run them. So in terms of looking at what the organizations involved with bariatric surgery say, we look at the guidelines written by Jeffrey Mechanic as part of the great paper done in 2013, in which it states that all patients should be encouraged to participate in ongoing support groups after discharge from the hospital. I think this is particularly important because there are requirements for pre-surgical psychological evaluation, but no absolute definite things required afterwards, although any program that hopes to get MBSA QIP certification is required to offer support groups, and I'm a big believer in that. I hope you will too. So, some of the reasons why bariatric support groups offer value to the patients you work with. Well, number one, it's an opportunity to see what's going on in the field, get the most current information. As we all know, there are changes that take place on a regular basis in terms of nutrition, in terms of behavior, in terms of medicine and surgery and so on. Groups are an opportunity to provide that information to patients in a very efficient manner. Another huge piece is the social support network. And as we all know who work in this field, that this is a challenging process and it's a lifetime commitment. And by developing others, a support group of others who share what you're going through, it makes the process much easier. And we'll look at some research around that too. It allows one to treat problematic behaviors. So if we see somebody who is wavering or shifting from the way they're supposed to go, it gives us an opportunity to engage them. And oftentimes hearing from others who have walked the walk makes a difference too. Sometimes family and friends might be invited, and accountability is one of my all-time favorite words. And when you have others who are hoping to encourage, the same type of behavior, people are often more accountable. Increasing program engagement, we have research data that tells us that individuals who participate in bariatric support groups tend to attend other meetings as well, and overall, as we say in the end, have improved surgical results. So how do you begin to start a bariatric support group? Well, first thing is you need to find a space that works. Make sure you have a comfortable room. Temperature should be reasonably controlled, proper seating, obviously should be bariatric appropriate. And one of the things to think about too is how far away is the room or the space from where parking might be. People don't often think about that, but that's a very valuable piece. When people are struggling to physically get to the room, it makes it harder for them to attend. Marketing, how do you want to utilize this? So, I've worked, in our program to do it through, we've done direct mail at times, we use email, we have it on our website. We also have a Facebook group that we invite patients into, and we list all those groups on there. Plus, when people come and meet with us, we have handouts that you can make very easily that show the dates and so on. You want to find trained leaders. Now, this can be a variety of different people, and we're going to be talking about that more in the future, but having a variety of leaders who are comfortable with a different group, monitoring for group size. So an ideal group is probably going to be about 15 around there, maybe 20. If you start getting much larger, it gets harder for everybody to be heard, in which case you may want to think about breaking into 2 separate groups and establishing ground rules. And ground rules are going to be very important. We'll talk about that in just a moment. So there are a number of different ways that you can divide your group. So sometimes people find it's useful to have pre-surgical groups, and I know we do that, and post-operative groups. Because the needs are different at those times. Adults versus adolescents, we don't suggest combining them if you see both in your program. Adolescents have very, very different needs, so having separate adolescent groups makes sense. Time since surgery, I think this is also valuable. In our program, we offer an initial bariatric support group at 6 to 8 weeks after surgery because people are just getting to the point at which they're having solid food, they're making adjustments, they're starting to get used to it, which is a very different type of group than somebody who's been out 6 months, 6 years, 20 years. Surgery types, some programs offer specific groups for bands or for bypass or sleeve or switch, whatever it may be. Personally, I find it valuable to just lump people together because there's something to be learned from everybody. And last but not least, there are specific themes, and this actually is very, very valuable. Think about getting back on track, those who have disordered eating issues, or those with substance. It's valuable to have those folks together. Another way to take a look at groups is instead of meeting in person, you can do online support groups. And this is, again, something that I've been involved with. We use Facebook Live as a way to offer online groups. But there are video conferencing programs, VC, GoToMeeting, WebEx, Fuse, and so on. Some programs use phones. You can do a phone conference so that people can get their group, especially for places where you have people who are living large distances from where they may have had their treatment. Peer-run support groups are another valuable kind of strategy in which you have individuals who've had surgery run it for one another. Those aren't necessarily the groups that might be necessarily run by the hospital or clinic you may work in, but they certainly are very valuable, and we've had a number of patients who have started their own. And last but not least, mentorship programs are very valuable, and that's something that we've been doing for a number of years, in which we develop a training program for individuals who've gone through surgery and now want to help others out, and they become mentors. Now, small group, you basically want to welcome people in and provide ground rules. And the typical ground rules include the notion that whatever is said in the group should be staying in the group. Now, it's certainly reasonable for people to talk about themes with somebody else or issues that may have come up, but they should not in any way be identifying anybody else who attends the group. Introductions are valuable because it's an opportunity to get everyone saying something. If you want a group to be active, you want to make sure that everybody has an opportunity to speak. If you have simple introductions, the name, the kind of surgery somebody had, maybe how far they've been out of surgery, and I make it a habit each month to ask some funny question or unusual question. What did you wind up doing this July 4th? Or, what team were you rooting for in the World Series? Or, it doesn't matter what it is. But just get them to speak for a few moments. Have some kind of presentation available. So ideally you have something to present to people. Developing an agenda is pretty self-explanatory. Ask people what they want to cover. Make sure you're allowing time for discussion, and of course, a little bit of a wrap-up at the end. In a large group forum, we have the same welcoming and ground rules, similar piece with a presentation, but we're really not going to have time to have everybody do an introduction. We want to allow time for discussion and wrap-up. I've done groups as large as 125 at times, and in that case, you would spend more than the entire group time to try to get everybody's names. So you try to keep the other pieces brief and, make sure there's time for the discussion. So when we take a look at research, it's valuable to understand that there are benefits that we can achieve. And a very significant study, it was one of the first ones done by Song in 2008, that took a look at 78 individuals who had gastric bypass. And they followed them for a year and divided the patients into two groups, those who attended 5 or less support groups or those who attended more than 5 over the course of the year. The results were pretty stunning. Those who had gone to more than 5 groups had a 55.5% excess weight loss. Those who had gone to 5 or less had 47% excess weight loss. That's actually a very, very significant difference. And that, one of the things that you see in the article, there was a nice graph that showed how things broke out. And really, the change takes place at 6 months. After 6 months, the difference between the two groups really comes to be very, very clear. So sometimes it's important for you to recognize that the longer somebody's out, the more important a group may be for them. We could take a look at another situation in which there are people who thought that they thought a group was important, or those who thought a group really didn't make much of a difference. And they were able to control in this study to see how far people live from their clinic. Now, oftentimes the reason why people don't attend is because they say they live too far. In this particular study by Orth, they found that distance really was not a factor. That those who attended showed a 42% BMI drop over a year versus those who didn't attend who had a 32% decrease. Now that's almost a 33% difference. That's 10% divided by 32. That's a huge change from nothing more than attending or not attending support groups. They were basically the same on other factors. Now, since there's less information about bariatric surgery in adolescents, there aren't quite as many studies about support groups in that age group. But one study took a look at both bypass and sleeve patients, and they found that these were individuals, for the most part, who had surgery at the end of their teens, around 17 and a half, 18. And they took a look and wanted to see what the difference is between those who had limited attendance versus those who had more attendance. And so they divide the clusters into those who went to no groups. 1/3 of the people in the study had gone to 1 to 3 groups. The other third had gone to more than 4 groups. And they tried to look at the differences and found that those who attended less tended to have higher BMIs, also had parents who had had bariatric surgery, which I thought was very interesting. And it may speak to the fact that individuals who have parents who had surgery feel like they have their support group right at home. And those, not surprisingly, who live farther from the clinic. However, the important factor was that those who attended more often tended to also go to have more clinic visits at both 6 months and 12 months after the surgery. And what you see as the increased visits actually is even more surprisingly large at a year. So the longer you go out, the more you go into the groups, the bigger the difference that we're going to find in attending all clinic appointments. So There's one major review article that was done by Livitz in 2011 and took a look at the universe of studies that looked at bariatric issues and found only a very small number even dealt with groups. However, one of the things that you need to understand is that every study that focused on bariatric support groups found that there was a positive association between support group attendance and greater weight loss. Thus, the more support groups people went to, the more weight they tended to lose after bariatric surgery. And it was a very nice positive correlation, one-to-one correlation almost. And in trying to understand what was making a difference in getting people to attend groups, and I think for any of you who are on this webinar today, this is stuff you're really interested in. Number one, making sure that you have flexible meeting times. And I know in our program we have some groups that meet early in the day, we have some groups that meet in the evening, and we have some who like to go to one, some who like to go to the other. A structured agenda does make the difference. Now, I mentioned that before. You want to have something in mind that you're going to potentially present on, but also make sure that I think you allow the individuals in the group to help determine that agenda, to make sure that they get something out of that that they came in needing. And also the notion of having novel topics. And in the next webinar that we'll do next week, we're going to talk about a lot of those. So qualitative issues that you need to take a look at as well when it comes to bariatric support groups. In a pretty significant study with 330 patients who had had gastric bypass, they took a look at them over about a year and a half and found that what people are looking for varies based on how soon they are fresh out of surgery. So those who are going into surgery are trying to understand how this surgery works. And we're trying to explain to them that there's no magic, that it's going to be hard work. You all know this already. What are the realities they're going to be facing? So what might they be dealing with both around the surgery itself as well as what's going to be happening to them in the months, in the months following surgery, and how these may affect them and those around them. I always try to remind people that there are relational impacts from somebody having surgery, as the person they're with or people they're with may not necessarily be comfortable with the changes that are about to take place. So we need to look at some of the relational issues. And again, we'll talk about that more, I think, in the next webinar. So 0 to 6 months post-op, not surprisingly, people are trying to understand how to deal with pretty significant changes in eating, how to help deal with some of the physical issues they may be facing as well. The emotional impacts, those are all critical. Longer out, 6 months more, it's how do we start to own the process? How do I make this my new way of life, my new normal? Dealing with body image issues, because with significant weight loss, the body is changing, and for many individuals, that's challenging. We're going to talk about that more as well. And how to deal with eating habits. And one of the things that we see over time, especially those of you who are dietitians in attendance, recognize that it becomes much easier to engage in a wider variety of eating habits, snacking, and so on, so we help deal with that. And I love the way this is summarized by Marcus. Group therapy provides the needed bridge between the worlds of self and others for patients following bariatric surgery. So, not a lot of studies based on this. Cranwell did a study to take a look at online support groups posts, and what they found was that a lot of bariatric patients are really looking at the appetite issue, especially lack of appetite shortly after surgery. I think the key to recognize in online groups is that they seek support and that when they get support, they feel more willing to talk about their problems and to feel that things are normalized. I do want to mention there is another study that came out a little more recently than this that found that the kind of information that is often posted on these online forums may be inaccurate, and it's very important to have a professional review that and with your patients, or if you have some kind of online Facebook group or something like that, to have somebody oversee it who actually does know what they're doing. So it's also important to recognize that there are benefits that don't have to do with weight loss, because most of the studies do focus on that. So there was, Glinsky found that individuals who attend bariatric support groups tend to feel more connected with others, and that they find it's easier to engage with people who they feel know what they have been going through. Another piece that we found, last piece of data I'm going to give you today, a Canadian study found that this was stunning to me. This is Dika Riva, and I'm just amazing. They found that those who are attending groups were twice as likely, 2 times as likely to be moderately to vigorously active in the first years after surgery. I mean, we are always trying to figure out how can we get our patients more actively involved with things. And it turns out this study suggests that those who have the support of others in a group are much more likely to exercise vigorously. So that will do right now, and I do thank you for your attention. I'm delighted that you came on board today. I do love this quote: if you want to go fast, go alone. If you want to go far, go together. Again, just a reminder, we're going to have a follow-up webinar next week, which will delve more into the how-tos and look at novel subject matter and so on. But in the meantime, we're going to have time for questions and answers. We're now going live with questions and answers. And first, I just want to thank each of you for attending. I hope you get something out of it. And I am going to strongly encourage you to come back next week. Basically, same time next Wednesday to see the real how-to stuff. Feel free to use your chat box to put in any questions you have. I'm happy to answer them. I have a couple already that I'm going to get started with, but in the meantime, if you have anything, by all means, put them in. So I think the first appropriate question to ask is, so what do you suggest to get participation going when you're just starting a support group? So this is a wonderful question, and I think one of the keys is to recognize that we want to take a look at any kind of marketing. Most people are feeling somewhat alone when they have bariatric surgery. Hopefully the team provides a lot of support, but for a lot of people in their life, they don't have a lot of people around them who have this kind of experience. So they look forward to it. We have tried to use social media. We use people's emails. We have, when we first started, we were making phone calls. We made up little quarter card flyers that are really useful, that have the dates and the times, and we give those out, I give that out at every new patient appointment, so that people are aware of these. Our dietitians tend to give them out. We have different kinds of groups, and so again, we make up quarter cards because it's easy to stick in your pocket. We use our Facebook group in order to do this, which is useful. And one of the things we try to do, and which I think is really important, is to try to get buy-in from the surgeons you're working with. And hopefully, if you were paying attention to the data I was presenting, you'll see there are many, many reasons why anybody in a program would want to help encourage support groups. So I think those are a number of those ideas. Another question that came in for the mentoring support: how do you deal with liability issues? So what we do in terms of mentoring is we have an orientation. And right now, we've been actually frustrated with the orientation that we've had do because people have to go through a hospital orientation, which means they also have to be checked for, vaccines and all kinds of stuff like that, which seems silly because it's a mentoring relationship. They're not going to be working in the inpatient unit in the hospital. But the key fact is we have everyone sign a piece of paper that says that they understand that they're going to be providing support to other individuals, who have had bariatric surgery. They are not going to be providing medical information, that any specific medical nutrition questions should be referred back to the providers, but that the individual is there to provide support, and they sign off saying, we have been informed of these are the limitations. It is not giving medical advice, and I've done this in 2 programs, and it has worked out well with that. So hopefully that answers that question. Another question is, how do you, which gets back to why I did this in the first place, how do you encourage your surgeon to support running groups in the first place? And I think, a key is to recognize that all the surgeons, are geared towards trying to get the best possible outcome for their patients. This is how, somebody sets themselves apart. This is how you establish, a great treatment program. And, it's so funny. I speak at these conferences all the time, And usually surgeons are in one room and integrated health members, everybody, non-surgeons, so whether it's nursing, dietitians, psychology, exercise, whatever, are in another room. And so a lot of times if you ever sit in the surgical ones, and I love doing that, they're talking about bougie size, they're talking about, where you make this cut, this thing, and usually they're saying, oh, I can get a little, maybe 3% better improvement, 4%, 5%, whatever. I've had a few surgeons come into my support group talks, and I say, oh yeah, we're getting, 10, 25, 30% better improvement in, people's rates, of weight loss, and they're blown away. So I think the data is always what's going to drive that. I've given you some seminal studies, which I think you can bring back if that's a question, and to recognize that another huge benefit is that individuals who go to the support groups tend to stay more involved in the program. In general, they keep more of their psychology meetings, more of their or social work meetings, whatever it might be, more of their dietitian meetings, nursing, physician assistants, surgical meetings. So if you want to keep people engaged and positive, this is a great way to do it. Let's see, somebody said, can we have your email to keep on getting some information? So sure, I have no problem with that. So my email, and I'll say it slowly, but it's not hard. My first name is Paul. So it's P as in Paul. My last name is Davidson. So it's P Davidson, P-D-A-V-I-D-S-O-N, at B as in boy, W as in Will, H as in Harry, or Brigham and Women's Hospital, BWH dot Harvard, which is like Yale, but it's Harvard, Harvard dot org. So feel free to get in touch with me. I'm more than happy to answer questions that people have. Somebody else said that they tried to do it, but they found they were having negative attitudes in their group. How do I address this? So I think this is one of those questions. We're going to be talking about this more next week, but it's kind of a good lead into that. So I will tell you that when I started, I had been working at another hospital, Tufts University, Tufts Medical Center in Boston, before switching to being recruited, whatever, to come to Brigham and Women's. And when I started, I started attending the support groups, and they did not have a behavioral health specialist working in that space. So they're all done by non-behavioral people. And sadly, I think many of the people in the group took advantage of this, and they created an environment which tended to be quite negative. So when faced with that, I think the first thing you need to do as a support group leader is to recognize that, hey, I need to put my stamp on this. And a piece of that is going to be letting people know that you have a certain outlook. And so when I started to do this, I said, I just want you to know that this group is designed to be supportive, and that those are the kind of comments we're going to be seeking, that I want you to be speaking about yourself, not making negative comments in any way about other people, and you lead by example. And so I was super positive, super excited and enthusiastic, and if you bring that, I think that's going to engender that in your group as well. What I have found is that when there are people who don't like that, they tend to stop coming. And it's so funny, maybe some of you will appreciate this. When I told our team and our surgeons that I wanted to make some of these changes, they're like, well, we might lose some of the people who've been coming. I said, I hope so. I said, that's the goal. They are dragging people down. There's a reason why all these other people are not coming. It's because there's such negativity. Well, anyways, I created a positive vibe, and what you can then do is you reinforce people in your group when they make comments that are positive or encouraging or supportive. And if there are people who are making comments that are negative or putting down in any way, that's an opportunity for you to say, hey, again, our goal is to try to keep this, as supportive and positive as possible. You're not going to give them a lot of reinforcement. And just like, it's shaping behavior. We do this with our kids. We had to do this in school. Some of us try to do it successfully or often unsuccessfully with our spouses and boyfriends, girlfriends, whatever they may be. So I think that's my bit of advice for that. And You're welcome for my giving. Somebody just said thank you for giving the email. We've got a few seconds, so I just want to tell you, look forward to seeing you next week. I hope, by all means, I thank Bariatric Advantage, Cassie Story, all of you for your attendance. Please tell others. We look forward to having more of you on board. You'll get a specific call-in time and a link to the webinar. And again, that will be more focused on how do you actually do this thing. And so I look forward to being back in touch with you next week. And again, thank you so much for your attendance.